Hello, everyone. I'm Jim Garrison, and I want to welcome you to day 182 of Humanity Rising. Humanity Rising is an initiative of Ubiquity University and over 300 partnering organizations from all over the world, representing people in over 130 countries that have come together during this pandemic to provide an open space on a daily basis so that people worldwide can come together to share experiences, solutions, concerns, issues, and most importantly, strategies that will enable us to ensure that the world beyond the pandemic is more sustainable and healthy and resilient, regenerative, and in alignment with natural systems. Over the months since we started on May 22nd of last year, we've covered virtually every aspect of the pandemic and various issues that are preoccupying all of us on planet Earth these days as we move into a critical decade where scientists are telling us that the issues have become so acute that we are in danger of forfeiting life as we know it. So it's in that spirit that we conceived and offered Humanity Rising. One of the issues that has become more and more apparent as the pandemic has unfolded, now over a year with us all over the world. It didn't go away as many of us thought it might in the spring of last year, and then the summer, and then the fall. Here we are in February of 2021, and the pandemic is still very much alive. Countries are still in lockdown. People are engaging in physical distancing. And one of the effects of the pandemic that has emerged to increasing public awareness is the issue of public health. Not just in terms of the physicality of the effect of the coronavirus, but on the mental health, the psychological health, the emotional health of people worldwide, as within a very short period of time, we were forced into isolation over extended periods of time for which we were not prepared. And whether it's alcoholism or drug abuse or domestic violence or suicides or depressions, all those have been on the rise. So we're very privileged and honored today to start a 5-session consideration of the public and mental health aspects of the pandemic. We'll also be having sessions over the next couple of weeks on how you can enhance your immune system. The vaccinations are, of course, the way that our governments are encouraging us to vaccinate ourselves, immunize ourselves, but there are all kinds of other ways to enhance one's immune system. So all those are in store for us as we move through the coming weeks. And I want to thank the panel and thank all of you for joining us. And now it's with great delight I want to welcome back Sabine van Gafka, who's been co-moderating with me since last May, as she can. Sabine, I turn the program now over to you. Welcome.
Oh, thank you so much, Jim. And it's truly with excitement and gratitude that I'm back on this amazing platform and catalyst for change, Humanity Rising, having the pleasure to co-convene with the ever amazing Jim. I just want to seize at least a few seconds to say I'm truly humble and amazed by the utter energy, engagement, and accountability of Jim that you've shown each and every day since the start of Humanity Rising in May of last year. Every day or 5 days a week, you've shown up to honor honor the ever-growing and impactful significance that Humanity Rising is gaining, thanks to the generosity of all the speakers that have been on board, that are coming on board, the partners, and of course, all of the viewers who help to make this platform sow the seeds of change, where each and every one of us involved truly are a catalyst for change, whether it's big or small steps that we take to really enhance the good and the better for the world and humanity. And I'm also thrilled to be part of this series of, to begin with, 5 episodes that are focused on health, sort of looking at a European perspective on the health ecosystem in a time of crisis as we're in. And I myself have both professional and personal engagement in a variety of holistic health and well-being projects. And health is really at the core of everything. And it's a topic close to my heart. And today we kickstart the first session, the first episode of 5, and examining different aspects of the theme health in its widest sense, and also with a holistic approach, sort of tapping on the surface, because going in depth would require so much more time. And today's theme is humanity and health, which couldn't be more relevant looking at the situation of the world today. And the initiators of this series of 5 webinars for Humanity Rising is a joint venture of 2 European health NGOs, Nordic Health 2030 Movement, and also the European Health Futures Forum. And both of them are really committed to supporting social change and also the evolution of health. And just to give a brief introduction to these both NGOs, Nordic Health 2030 is a network of 30 or more Nordic organizations that are supporting better health through an equal balance between care and prevention. And they're value-driven and committed to trust and openness, creativity and innovation. And they are represented for these seminars by Lars Munter, who is the co-convener of today's session and all the other 5. And Lars is project leader of communications for Nordic Health 2030. And he's also head of International Products Unit at the Danish Committee for Health Education in Copenhagen. And then we have the European Health Futures Forum, which is an international network organization that seeks to transform healthcare and improve the well-being of European citizens by highlighting and addressing prominent factors impacting health and wellness. This NGO is also value-driven and really seeks to address, through the lens of health and well-being, issues such as social coherence, dysfunctional financial models, environmental sustainability, and education. And the European Health Futures Forum is here represented by David Somek, who is Network Director and who will be co-convening all the sessions together with Lars. And we're going to open the panel session with a panel of experienced and knowledgeable industry experts taking a health perspective by considering health this time in a context of society, of communities working together, of sharing collective and individual responsibility, both to preserve but also to improve health and well-being, and also to support the transformational change that is happening within society for the better of the planet, the environment, the people, our children, and for those who depend on us. And as usual with Humanity Rising, before we start this, let's also look at health from an inner perspective with a 1-minute heart coherence meditation to really center and align ourselves, open our hearts and our minds, and feel a moment of gratitude, maybe for your own health, and also send blessings to all other people for their health, and of course, for the health of our planet. So 1-minute heart coherent meditation, hopefully with some music in the background. thank you for joining in on that 1 minute heart coherence. And I just thought I'd mention, because I just been hosting another seminar on the future and science of healthy buildings. So behind me here, I'm actually standing, speaking of health, in a healthy building of Nava and Signify, who work with light and also with plant-based walls, in case you're wondering of my background. Now, before I hand over the word to Lars and David, we'll start this session with a 2-minute video from Ireland that will introduce the concept of today's session, the connection between health and our planet. So let's roll the video.
Hello, my name is Sean and I'm Company Secretary and Director of EHFF, but I'm also a forester. I realise the place that trees have in the Irish psyche, but I also realise that to the general population, trees are really, really important. Trees link the soil and the sky, but they also host myriads and myriads of creatures, small and large. During COVID, we have become much, much more aware of the interconnectedness of nature and the human species, and the need for us to have a healthy environment so as to have a healthy planet, and indeed for the human species to be healthy as well.
Hi, my name's Iseult and I'm also a director of EHFF. COVID landed me here in County Kerry at the foot of the McGillicuddy Reeks, where usually it's quite busy with coaches and people coming to visit, but this year it's been very quiet and I've had a great year exploring and running the quiet country roads and the trails by the river, and enjoying a sense of peace and quiet that usually isn't here.
There's a growing interest in forestry circles in Ireland to transform some of our monoculture Sitka spruce plantations into continuous cover forestry, or what is often called close to nature forestry. And one of the principles that's in this process is of natural regeneration, where seeds which are dormant in the ground for many, many years, when the conditions are right, start to appear. So as soon as light comes in and when these trees get a chance to prosper again. There's an obvious parallel with our healthcare and health systems, where seeds which have been dormant for many years are ready to come out when the conditions are right. And this is the challenge for us who are involved in the transformation of healthcare. Hello, my name is Sean.
Oh, bugger. Right, sorry about that. Okay.
At least we now know that your microphone works, David.
What about yourself? Where are you?
Would you like to start, David?
By all means. Our colleagues from Ireland have set the scene for this webinar. The first, as you know, of a series on the future of health and healthcare in Europe. We'd like to welcome you and introduce ourselves. That is, Sabinia's done a great job, but I'm David Somick, Network Director of EHFF, the European Health Futures Forum.
And I'm the mentioned Lars Münter, the Head of International Projects in the Danish Committee for Health Education, and also responsible for the communication in the Nordic Health 2030 movement. All of these organizations in the movement and connected partners in the European Health Futures Forum are organizations and people committed to the transformation of the current health and healthcare model. And you can find out more about our organization and the Nordic Health 2030, the DCHE or the EHFF in the links we'll provide shortly in the chat box.
Indeed, yes, I'll do that after we've made our introduction. So further to the kind words that Sabinia said, we're really very grateful to Jim and Ubiquity University for this opportunity to contribute to Humanity Rising and the Global Solutions Summit. Jim gave the background of COVID, but we're looking at it from an overarching context, and then you'll see how the relevance fits in as the stages go on. Health and healthcare is a complex topic, and even in 5 sessions, we can do no more than give you what you might call a tasting menu of how things are changing and what needs to change. Why a tasting menu? Well, Lars and I decided to give you small tasters in each of the 5 webinars from several esteemed colleagues with the idea that it would whet your appetite for longer, more in-depth presentation discussions that maybe can happen at a later date. By covering a lot of material in a short time, we'd hope to give you a broad outline of what we think matters and how it connects to other global issues.
Yeah, but to give you a brief overview, during our 5 sessions, we will explore the relation between individuals and communities as we do today. We will look into health as a construct and the relevance of design with it, the relation between eco as economy, eco as ecology, digital health and the transformation within that, and the role of mental health in our workplaces, especially as part of our lifelong skills and needs. David and I will be your friendly hosts during these 5 sessions. It's a hike we've looked forward to.
Indeed. So let's get going. Lars will compare. He'll be the compare for for our first group of presenters on the subject of community engagement and its relevance to health. So over to you, Lars.
Yes, thank you, David. And without further ado, I'm very pleased to introduce Cormac Russell, an international social explorer, an author as well, and a very dedicated soul towards community development. Welcome, Cormac. Your mic, is that working?
Lars, everything I think is working. Can you hear me okay?
Yes, very much so.
Well, greetings to everybody from Ireland, and thanks to our hosts for creating this important civic space. I think it's incredibly vital in our times that we're intentional about how we convene and how we create space for people not to think with their opinions, but to think about our opinions. So I want to share a few thoughts to begin with about our opinions around how well-being, health, and indeed the future of our planet can find flourishing forward. I prefer to use the terms flourishing forward fairly than building back better. I'm not convinced by that construct. So as we think about flourishing forward fairly, I think of Hannah Arendt's insight that the more isolated we are, the more susceptible we are to become the harvest produce for extremism, and polarization, as we know, is a huge issue. So these civic forums allow us to become civic and to really think about something that matters to us in a way that also allows us to matter to each other. And so our thoughts are less important than our relationships and our building of community. I'm here to speak for a few minutes about the idea of community and about how community is a central idea, but not just an idea, an experience, a way of being in the world, which I feel is important now. Ancient wisdom, indigenous wisdom, tells us that it is critical that we have culture and ritual in our lives. And as we know, that's something that's been bereft pre-pandemic. In some ways, it's probably being brought back to us in a way that seems almost imposed or forced. These ideas of experience, of transition, of trial, of learning how to be, for example, physically different or distant, learning how to be at the same time hyper-local. These are very, very challenging pieces for a modern individualistic mindset. But indigenous culture has always had this idea that there are 3 phases within which we learn to be in community. The first is physical distancing, where we go away. The second is trial, where we take time to find the genius and the gift and the contribution that's within us. And the third is returning back to community, to share that gift and have that gift received by the community. We call it a rite of passage. And in many respects, this rite of passage in terms of health at the moment is reminding us that health is not a medical matter. It's a social, it's an ecological, and it's a political matter. It's a question of social justice and planetary justice. And so one of the challenges with that is I think that many of the current responses at governmental level to COVID-19 are what I would call a Humpty Dumpty strategy, where all the king's horses and all the king's men will not, in fact, put Humpty back together again. So in this brief comment, I want to suggest what we need to do is jump over the imperial wall and get to the fringes, get to the edges, where civic life, indigenous life, and indigenous wisdom are still flourishing, almost in spite of imperialism. And where we begin to think about ourselves not as individual, isolated, compliant beings, but as creative beings, committed to each other, committed to community. My father used to read me the nursery rhyme of Humpty Dumpty when I was very small. And even at a young age, I wondered, what would happen if we thought more about the other side of the wall? What's on the other side of the Humpty Dumpty wall? We know that Humpty didn't fare out so well on the king's horses and king's men's side. But let me bring you to the other side, because on the other side is community. It's the informal civic space where we're joined together through gift rather than economy, where the hatching and the catching of Humpty Dumpty is possible. You see, I think flourishing forward fairly isn't about applying force from top down, which, as we know, if we apply it to an egg, is how best to end life. But actually, flourishing forward fairly is about hatching. It's about changing from inside out. And that's difficult in a world that has become really quite indoctrinated to the idea of what I call the institutional assumption, the assumption that my health is in the hands of a doctor, the assumption that my child's education is in the hands of a teacher, the assumption that our safety and our well-being is in the hands of police officers. We heard about the forest. In a way, in many respects, we all now live in a forest of institutionalism, where that has become our environment. And if it isn't formal institutions, it is more indigenous hidden persuaders like Cambridge Analytica that are harvesting our data and then feeding it back to us and making us think it's our opinions and that our opinions matter more than the people that we call our neighbors. So how do we emerge from this institutional forest? Well, I think that it's a 3-lane highway. And we need to figure out a way, as we flourish forward fairly on this highway, to recognize that there are certain things that only communities can do to be healthy and well. That it's not a matter of institutions or services or programs. It's a matter of how we're actually in relationship with each other, in right relationship with our planet and each other. We are our brothers, sisters, planet's keeper. But finding a way of being in those relationships is really critical in a world that has taught us to dissociate and be individualistic and to be consumerist. So how can we really recognize that one of the first lanes that we must travel on is the lane whereby we figure out together how we can be better at being human? The second lane is a lane where we can co-create better outcomes with the help of outside actors and agencies. And the third lane is where we do need institutions to do a range of things for us. I want to propose that actually the issue isn't about getting the balance between experts and amateurs or communities and institutions. The issue is how do we get in right relationship so that we address what I call the institutional inversion and the democratic inversion. The democratic inversion is this. If we have a mass of people who believe that their democracy and their health is in the hands of experts and professionals, then they're outsourcing their agency to others. In a democracy, as I understand it, at the heart of that democracy is this idea.
At the center of a democracy are citizens working together in allegiance with other citizens, including people whose opinions they disagree with, finding ways to bring strangers in from the edge and deepen associational life with each other and the planet. And at the heart of that, in a democracy and in a welfare state that shores up that democracy, we have professionals, we have agencies, we have institutions, and we have science that supplement those capacities, not overwhelm, demean, displace, or subdue, but supplement and build up. And so in many respects, as I close my remarks, I want to say that I think we are beginning to see examples where this 3-lane highway is working in a more optimal sequence, where we're recognizing that there are things that communities can do, just like we saw in March and April and May, when as the institutional world hit the limits of its capacity, almost like a hydraulic relationship, we saw as the institutional world descended, the civic world ascended in all kinds of ways. Now, the question is, what is the precipitant act that would precipitate that community response into the future? If COVID was a negative precipitant, what might be a positive precipitant to more civic-led action with institutions supplementing that action? Not just with regard to health, but also with regard to safety, with regard to social justice, with regard to ensuring that people don't have to make invidious choices like choosing between their life and their livelihoods. And I think we're seeing early shoots of that. Milwaukee, for example, its blueprint for peace, which is essentially its response to high rates of crime in certain neighborhoods, is a very good example of what happens when you move from an enforcement paradigm to seeing criminality through the lens of public health, and recognizing that when you take some of the budget away from policing in terms of enforcement and you relocate it into community alternatives in the neighborhoods which are challenged most by economic injustice and oppression, then what you begin to do is you begin to create better outcomes. And of course, as you do, well-being, health, and safety emerges. So in many respects, it feels to me that flourishing forward fairly is about finding community alternatives to standard top-down institutional interventions. We will not command our way out of COVID. In the end, nature, of which we are part, will remind us and humble us that we can only really address this challenge by ensuring that those that are furthest to the margins are brought to the center. And so as I conclude, I'd say that the challenge around health is one of building anti-fragility, putting citizens at the center, taking democracy seriously, and supplementing those capacities with the resources of expertise. In my mind, that's democracy working as democracy should. Thank you.
Thank you, Cormac. I'm sure that there will be a lot of questions for you, especially for the flourishing forward fairly, but to my mind also about the outsourcing of agency, I'm sure. We will have an opportunity to ask questions for Cormac in a session slightly later when we have a debate between our first presenters. But right now, let me give the floor to Jim Phillips, a dedicated community engagement specialist, also running the Center for Empowering Patients and Communities based in Ireland. Jim?
Hi, thank you, Lars, and a huge thank you to the earlier introductions, and thank you for taking the time to centre everyone as well through this shorter 1 minute of reflective meditation. As a mindfulness teacher, it's always lovely to see that. I guess what I want to do, reflect upon, is picking up some of Cormac's themes in a way. He talked about institutions, and we do have these institutions. We can't get away from that fact, and they can either be a block or they can potentially be an enabler as well. And so what I would like to talk about is a little bit around what we're doing in England, some of the approaches within the National Health Service, and some of the approaches around actually happening in government as well, to really sort of support this transformation and recognize the importance of community and how we actually bring that into health and healthcare. And this is operated under a number of themes, such as transforming the medical model, rethinking medicine, and how do we move on from that 19th, 20th century view of medicine and health and moving much more towards a 21st century model of health and engagement and take it forward as well. So how do we do this? I'd like you to take a moment just to reflect on a couple of things. When we think about health and well-being, and if maybe we've got a long-term health condition, we might have depression, anxiety, arthritis, multiple sclerosis, diabetes, all sorts. If we take a moment to reflect upon that, what is it what enables us to stay well with those long-term health conditions? You know, what are the factors which actually contribute to that and allow us to stay well? Now, the traditional medical model would immediately say it's a clinician, it's a treatment, it's a drugs, it's a surgery and everything else. That's what makes us stay well. But in actual fact, when we think about it, what enables us to stay well and have good health and well-being is the quality of the communities we live in, our environment, the actions and the choices we make every single day around what we eat or don't eat, what we drink or don't drink, what we put into our bodies, the exercise we do, the walking we do, how we interact, our worldview, is it a positive worldview? And I love the reflection on gratitude in the introduction. We do a little exercise in which is actually on the NHS called which is a gratitude exercise, where we get people to reflect upon, you know, the positive things in their life rather than the negative. But going back to this, what constitutes health and well-being? When we look at studies, when we look at the evidence, actually only 20% of this comes from traditional healthcare. So if we've got a long-term health condition or something else, only 20% is coming from our healthcare provider as a sort of average, as it were. The rest, like I say, is the decisions and choices we make, our environment, and quite a lot of things in our control and out of our control, and the community that we live in as well. So if we really take that on board, that means if we are going to have healthy communities, healthy societies, healthy individuals, the quality of the communities that we live in and our attitude towards our own health and well-being and how we treat ourselves is just as important as that appointment with the doctor or the GP, if not more so. What people value most as they age and also they accumulate long-term health conditions, what they really miss is things like loss of connections, the things that they value doing in their day-to-day lives. And we also know that what we can do as an individual is also limited as well. We can't have social connections on our own. It doesn't work. Yeah, we need that participation. However solitary we might be in our nature, we also need those connections as well. And we know that social networks promote health by providing access to these social connections and sense of well-being as well. Provides access to information, resources, and participation in community organizations. We know from the evidence it raises people's health status. People feel better. Participation in this sort of thing actually enables us to draw upon our own assets, our own innate ability to solve problems, to work through solutions collectively with other people in a similar situation. And that process actually empowers us to take back control of our own health and our own healthcare as well. It moves us away from being passive you're the doctor, you tell me what I should do. And when that doesn't work, I blame you, the doctor, to actually thinking through, I'm a partner in my health as an individual, and collectively my community as well. And collectively we can support each other through this. So how do we do this? We've been working on this in the NHS for quite a number of years, actually, and we're actually starting to now develop a bit of a model around this as a recognition of how important communities actually are. To put it quite simply, saving healthcare services a hell of a lot of money as well. I mean, there is a financial implication here, and we can't get away from that. And unfortunately, finance often drives healthcare. So what we know is that we need to enable and empower citizens to develop health literacy, to have the confidence, knowledge and skills to be able to manage their health and well-being based upon what's important to them and their values, not the values and importance dictated by the healthcare system, but based upon what's important to them. But also that the health and social care workforce have the skills and the ability to enter into those conversations with people around what's important to them and what really matters to them, rather than dictating to them what the health outcomes should be. But also then that the health and care systems are what we call co-produced, what we call strategic co-production. So citizens are integral and fundamental to actually co-producing the healthcare systems that we want to see happen. Okay? And that also barriers to universal healthcare are proactively reduced as well. And that communities are empowered to become healthy communities as well. So there's these different elements that we need to be proactively working on as well, so that everyone has the skills and the confidence to work in a partnership way to solve common issues. And in England, we've now actually got formal legislation around involving citizens in the design of healthcare services and training programs to actually empower and enable citizens to have those skills to be able to work in that way as well. And what we started to do now is actually say that, and we've got a whole scheme, what we call social prescribing. So what we're now saying is that in healthcare, everyone has a personalised care and support plan where the emotional and psychological and community elements of that care and support plan is given equal status to the clinical interventions as well. And not only that, we have things called community connectors or social prescribing link workers who proactively sit down and work with individuals around what's important to them and what matters to them, and look at how they can connect them to community initiatives and community groups and community things, but also take a role in actually fostering the development of those groups and things as well. So this is everything from garden groups. So we've now got allotments and vegetables growing in GP surgeries, and you'll hear a bit more about that from Ed a bit later. We've got garden groups, walking groups, people going out planting trees and all the rest of it on prescription. You know, almost the same way. So rather than prescribing antibiotics, well, not antibiotics, but antidepressants and painkillers and things, actually supporting people to do things and get back into their lives, things which are meaningful and important, and actually facilitating that and helping that. And through that, what we found is that our institutions are now really recognizing that if we just focus on the biological traditional medical model of health and well-being, we're just not going to solve all of these issues at all. And there's a real recognition now that unless we address the community issues and community cohesion and everything, we're just not going to get the health and well-being we want to see within our societies and everything. I mean, this raises various issues around funding and money and value for money, and these are the questions government ask. And so, well, you know, what's in it for us? You know, so how do we justify spending money on this? Well, what's the return on investment, to give a hard-nosed thing about it? So one of the questions around this is, well, how do we measure it? Is it measurable? You know, institutions like to measure things, they like to quantify things, they like to stick round pegs in square holes and bash them until they fit and everything else. So we have developed measures. We've developed Southampton University, lovely little measure which goes with a snappy title of the collective efficacy of networks. But what this does is actually enables us to really show and demonstrate in an empirical, evidence-based way that actually when people are connected into community networks and they've got strong social networks and feel a sense of social cohesion, they do have better healthcare outcomes. They use healthcare services less, so therefore they also cost less money as well. And that's the argument that we've been making in England within the NHS. It's now got notice, is now a core part of a national strategy and supported through funding and supported through a whole network of people employed specifically to work around that whole area as well. I mean, I have got slides on all of this, which I can show you, and references and all the rest of it. But I really just wanted to sort of talk you through a little bit around our vision, the work that we're doing, and really how we're trying to rethink the medical model and transform the medical model away from a purely biomedical model to what we call a psychosocial model of health, where the importance of community, our ability to self-manage, where health literacy, our sense of control over our lives and everything else becomes core to our healthcare and the way we work as well. And I don't think the system has to break to achieve this. I think we can transform the system. It's not going to be quick, but we are doing it and we are seeing the results and we are seeing this happening. So I've got real hope around this and the way forward. And it works. It's as simple as that. It works. We know it works. We've got proof it works. We've got the evidence, and it's brilliant when you see communities coming together in this way to work collectively on health and well-being alongside the individual and alongside the medical as well. Thank you.
I completely agree, Jim, and I think there will be a chance to ask you more questions a little bit later. And we now have an opportunity to actually then present Matthias Sveum. We're moving a little bit geographically now to the Netherlands. Matthias, can we check your camera, your mic, perhaps?
I think my camera is on. My mic is on as well.
Yes, you're here. And while he's not actually sitting in a Dutch canal, that is just modern photorealism for you. Without further ado, Matthias, please present your work in the community and community engagement, please.
Yes, I will. So just to introduce myself slightly, I'm Matthias Sveum from the Netherlands. I'm on the advisory board of the EHFF, one of the organizations that's doing this. Thank you so much that I have a chance to be here and be part of Humanity Rising as well, a little bit then. I have a presentation set up for you. Just looking at me talking isn't the nicest thing to do, so I have some slides. And I do this presentation from my role as a strategic partner for the municipality of Utrecht regarding the Health Pact Utrecht. So I will share my screen right now. I hope this will work as planned. I'm hoping to turn my camera off, but it won't. So you're looking at Utrecht, by the way. So the Health Pact Utrecht came or hatched, like Cormac said, in 2019. And it was because of the alderman in Utrecht, who is by law responsible for the policy in public health, said public health and policy is one thing, but there's so much more. So he started a line in the coalition agreement where they say we should start a health pact Utrecht, where everybody who wants to contribute to health gets that possibility. And that's how we started. That just one line in a huge leaflet of how political parties agreed on working together in a beautiful city. And I will take you along this story we built up with each other, with citizens, with organizations, with institutions, etc., to give a small view of how we think you could be community up. And also use top down, by the way. The beautiful city of Utrecht allows us to see what's happening within the different neighborhoods. Just to make sure, I don't believe everybody knows Utrecht, so I will give a small introduction on what Utrecht is or where it is. Utrecht is the 4th largest city in the Netherlands. It's a fast growing city. It's an historical city. Next year, we will be celebrating our 900-year anniversary. Currently, there are about 350, 260,000 inhabitants. Just realized that in the Netherlands, that's a big city. We will have grown to 400,000 citizens in the year 2024. That means that we will encounter a lot of challenges, and also regarding public health. Thinking about these challenges, it's quite remarkable that Utrecht decided almost a decade ago to put healthy urban living for everybody as its main focus. And this is visible in many different levels. Very recently, our new public health policy was accepted by the City Council. And in Utrecht, we try to look at health from a positive and broad perspective. That means that we put health in all policies. We want health equity in all policies, and we work on themes as poverty, behavior, to make the city a healthy city for everybody. And a lot is happening already in Utrecht. So the arrows show that in every single street, in every single neighborhood, there's something happening. And before COVID, it wasn't really apparent who's doing what. Nobody exactly knew what was happening in the next street. But also organizations had slightly a clue on what's happening on different levels in this city. And the interesting part is that we as connectors, the group that started the Coalition of the Willing, are just connecting those initial arrows. We are building a network of professionals, a network of initiatives, and we try to come together to inspire each other, but also to attack wicked and complex problems. And we have minor guiding principles, and that's why guiding principles, but because that's giving us a slight direction of where we want to go. But the interesting part is that the more criteria you have, the more principles you have, the higher the barrier of joining will be. And especially for inhabitants of Utrecht, the Utrechters themselves, who we highly want to invite to join this network and are joining the network. So the guiding principles is that it is a dynamic network. It's like an organic network that moves in and out. If you are in, you're not in for life, you can move out again. Everybody can contribute, so not only organizations or people that are working in and around healthcare, but if you can help your neighbor, or if you can help somebody in your street, or you become a collective and help other people, you can join. It should be fun, and that sounds odd to some of you, but working on health, working on happiness, working on inclusivity, that can be fun and should be fun. And it's based on the Coalition of the Willing. So of course there are also restrictions. I think Cormac Russell said a lot about it, that we have to move forward, and the Coalition of the Willing are the people that put their shoulders under these huge tasks. And within the network, we share inspiration. We try to help each other. We collaborate. We co-create. We attack the wicked problems on a local level, and everybody can contribute. So the more perspectives there are on a certain question or problem, the more interesting it will become. This is, we try to depict our network, and I think the swarm of the flock of birds, the flock of birds depicts our network, I think, the best. And it also is based on simple rules, because this flock is based on don't bump into each other, don't get too far away from each other or off the center of the flock, and fly in a parallel direction, follow your neighbors. And everybody knows that a flock of birds can have the most amazing shapes and forms, and also it seems organized. So with only a little amount of organization, huge intricate forms and shapes are realized, and that's how we work as a network. And based on what Sabine said also, health is everywhere. Everything is health. And that's a movement in the Netherlands that's much bigger than the city of Utrecht. But the fact that almost everything we encounter in day-to-day life has an effect on our health and our happiness. And that means that we have a very broad sense on what are the influences of health. So in this network, it's not just people from health and welfare and the curative sector, but it's like people from nature movements, people from an art background, people from all kinds of different backgrounds that have an effect on health are part of this network, and make sure that we have like a real vast creative view on what's possible in the light of a certain task or problem. And it's about pioneering, and pioneering is I think everybody knows what pioneering is, but sometimes it's people talk, but it's not about innovation. But this isn't about innovation. This is about doing stuff for the first time on a certain task or problem. So the way the Utrecht city is working with everybody as a partner of the city. So it's not the top down, but they are being a real community partner and try to find ways of interacting with each other on a constant level. So not about participation in policy, but how can we participate in local solutions, in the neighborhood, and in initiatives that need help in the neighborhood. So we did a Healthy Idea Festival. Now, Healthy Idea Festival were 15 real practical problems that went on the stage, and people from all kinds of backgrounds, 150 people from Utrecht. Almost everybody came from Utrecht, so has a special connection with Utrecht. Try to work on different solutions. So there were people from a cultural background, from arts, that said normally we would go to a cultural festival. We see people from the same domain, from the same sectors. And now we are here connected to people that come from so many different backgrounds that it's interesting in how we missed solutions in the past, but we are now working positively forward and try to find all kinds of new ways of working together to find solutions. So in that way, we are pioneering, and we are becoming a dynamic network. So we asked people to join us and sign a pledge. It's a diverse group of people, and we made sure that we signed this pledge, not so much to be hold in the air like I do with my colleague here, but make sure that everybody feels that they are equal. So on way of the left, the picture, there's the alderman, and he signed as a partner in the network. So it's not a network to come to solutions for governmental problems. It's we are part of each other. We are part of this network. We have to do this together. And Amina, the woman standing next to him, said, we doing this together or we won't do this at all. So it's quite amazing how this got and gives people energy. So besides doing pledges, doing amazing work in neighborhoods, we're offering a stage and dialogue. So in times of Corona, all kinds of networks popped up that were really connected to that local level neighborhood initiatives. And we started conversations on vaccination, conversations on staying sane, staying mentally healthy during the corona crisis. And these dialogues are open for everybody. So it's a chance for people from the community, but also from people from institutions, from local government, to join and talk together on a certain topic, not from your expertise, but from being a human being. Another thing we did is the Healthy Empowerment Symposium, where a lot of the other panelists were part of. And the interesting thing there was that we all know this central institutions. In Europe, it's in Brussels, and I think all over the world you have the central institutions that are comprised of all kinds of bigger organizations. And how interesting it was to invite them to Utrecht and to be connected to those local initiatives. So have a vertical connection between all kinds of initiatives and seeing actually what's happening on a local level. And we, of course, tried to do this on a very creative way. We had a caravan with all kinds of stickers that allowed people to talk freely about what their achievements was. We had healthy brokers sitting on the right. This is where we do it for. So this is my background picture, but this is also the picture I want to close off my presentation with, because this is how Utrecht is remembered by Utrechters before the COVID. And what happened during COVID could be stated as it's really bad, but it's also, we are very thankful for what we had, and we hope to get that back sometimes and do that together as a community with all kinds of organizations that contribute to that. This was my presentation on the Utrecht Health Pack. I can talk about it a lot more, and I can ask your questions or answer your questions on a later stage. So thank you so much.
Thank you very much, Matthias. There's a lot of questions coming in, I guess, especially one you might repeat. The pledge you mentioned, Matthias, could you please repeat what that pledge, the signing pledge, what that says?
Yes, so the pledge, it was quite easy. It's a half A4 paper, and we try to find a way to not go and start a contract together, but it's like the commitment we share on improving the health of every single Utrechter. So that's our ambition, that's our goal, and that pledge allows us to make it real visible, take pictures, getting out there, do some PR work. But the interesting offspring from that is that the next thing that will happen, mental health was already mentioned. There are all kinds of things happening now in Utrecht on that topic, and the Health Pact is possibly one of the groups that will work together on that mental health question.
Very good.
So it's easily moved towards new complex problems. That's what I try to say.
Very good. I will encourage you all to keep asking questions for both Cormac, Matthias, and Jim. There'll be an opportunity to ask to discuss a little bit later. I think we will go on to some practical cases showcasing some of the points that Cormac, Jim, and Matthias have shown again and again, the value of engaging the community. David, are you ready in the studio?
Yes, I'm ready. Hi there. Right. So, folks, we're really running a little bit late, and I was going to show you a couple of videos to illustrate what people have been talking about, but I only have time to show you one quick one, which was kind of referred to by Jim, which is about how a primary care practice in inner London, the city, is tackling health in a wider sense than just giving people medicine. Now, two things about this. One is this is a GP practice. Now, for those of you who don't know what that means, general practitioners in England are primary care physicians. So we talk about GPs, we mean primary care. And secondly, I apologize for this video. I think it's really nice little video, but it's actually taken from Facebook. So we couldn't get rid of some of the the stuff that goes along with it. But anyway, I'm sharing my screen now, and I'll start the video right now. Like here. Okay. Let's go.
The Lambeth GP Food Co-op is a community-led cooperative of patients, doctors, nurses and Lambeth residents who grow food together. We work in partnership with GPs across the borough, building gardens in GP surgeries and developing unused spaces for food growing purposes. We have built 11 food growing gardens in GP surgeries where patients are actively involved in growing food together, including a garden in King's College Hospital, where we have a monthly stall selling patient-grown food. We were awarded the Best Sustainable Food Initiative in the NHS by Public Health England and the NHS Sustainability Unit.
It got started from a conversation with GPs, patients and nurses located in Lambeth, who were interested in whether we could create a network of food growing gardens across general practice in Lambeth. We were fortunate enough to attract support from Lambeth Council. We also have a very forward-looking and visionary clinical commissioning group in Lambeth, who also funded us to get the Lambeth GP Food Co-op up and running. We have a community across the borough who are involved in different activities interlinked around food, diet and nutrition. The aim of this project is to influence food procurement. It's one of the aims in the NHS. We have 60 hospitals in the M25 corridor. Not one of them buys anything grown locally. We're looking at this one as having an economic context as well as a therapeutic context.
Being part of the food co-op is part of a much bigger ambition that we have, which is really trying to melt away the walls of the surgery and become a much more open building or place for the community where they can come and have access to health and well-being.
The kind of patients that I recommend coming to the garden are people who may be a little bit isolated, maybe have depression, low mood, other mental health problems that make it difficult for them to get out.
Those with long-term conditions or who are socially isolated, or anybody actually who is interested in keeping fit in another way and meeting other people in the group.
The Lambeth GP Food Co-op is a community-led cooperative of patients, doctors, nurses and Lambeth residents.
See how non-technical I am, I'm afraid. But there you go. I'm just giving you one little example. We've got plenty more, and we'd love to share them, but time runs on. So what we can maybe talk to you on the chat or afterwards about how we could share some of those other really quite heartwarming examples of how people are stepping outside of the medical model. Now, I'd like to go on straight away to our next presenter, who's a dear friend, Christine Sorenson from the Global Academy for Health Literacy. And without further ado, I'll hand over to you, Christine, to make your presentation.
Thank you so much, David and Lars and everyone for hosting us here at the seminar on humanity and health. It's a pleasure to join the community on humanity rising. And my presentation today is really a call for help. So believing in co-creation, I'm bringing you a concern that I've had in my work on health literacy. So for the last 10, 15 years, I've been involved in health literacy. So that's the about the knowledge and motivation and competencies to find and understand and evaluate and use information to manage and cope with health issues, both at individual level and organizational level in communities and at societal level. So I do advice for policy, for NGOs, teaching also. And in my work, as I say, I often get the question, while we try to bridge the gaps of inequity through health literacy, there is also a concern that we don't always do what we want to do, and that instead we actually widening the gap, especially through the language that we use. And a lot of the work is, of course, with vulnerable groups when we talk about inequity, and looking at some of the issues related to human rights. You see a long list of groups that we care about and concerned about. So women, children, migrants, displaced people, stateless people, minorities, indigenous people, disabled people, people with different diseases, Romas, and people with different sexual preferences. And in my work in health, we often, categorize people as being low education, poor, homeless, addicts, or unemployed. And when we try to describe these groups, we use all kinds of labels, such as being vulnerable, hard to reach, excluded, underserved, hidden, disadvantaged, on the edge, and so forth. And while we try to be politically correct, sometimes this kind of labeling has the opposite effect. Often they would say, we're not vulnerable, you're making us vulnerable, the system is making us vulnerable. It's not us that are hard to reach, it's the system that is hard to reach, and it's not us being so, it's you or the system not serving us well enough. So we question it, and in our efforts of trying to reach and trying to build bridges, we actually sometimes widening the and exclude even more just by the way the terms we use, and because we make those people then stand out. Other examples of this include, we talk about people-centered health, and people say, well, we don't, patients or these groups that we talk with say, we don't want to be in the center. We want to be part of the circle. We want to be part of the crowd. We want to be recognized as equals in this dialogue or in this work that we have. When we talk about giving voices to the voiceless, this is also a sentence that's being used very often. The people saying, well, we always had a voice, you're not giving it to us, we had it. How can we make a way where we actually, in our attitudes, in our way where we talk, become much more inclusive, instead of actually discriminating, even it's not really our intention to do so. So some of the alternative levels, but I haven't been able to find much. I've been trying to look through the literature, trying to find guidelines, and people say, well, what about priority groups? What about local communities? But is that the right term? So I'm looking to this group. I think this is a unique opportunity to hear your advice to me, to my work, to my colleagues. What kind of wording can I bring on? Also, I'm not a native English speaker, I'm Danish, and we have some of the same issues in Danish in my own language. So I'm really happy now to hear your advice. I think, of course, what we should always do is try to acknowledge that groups are not homogeneous. We need to respect diversity. Some of the other speakers said that as well. We need to listen, and we'll be much better in listening, instead of just telling people what to do. We should enhance, co-creation and tailor communication and services to people's needs, and not just take them for granted, to know that we know what is best for them. And also, whatever we do, try to facilitate the work that we do with respect to languages and cultural sensitivity. And really, I think one of my major concerns is also a lot of the things that are put in place are project-based. It doesn't really resonate with the sustainability that we want to build up. It's always kind of pilots, and it always ends when the money is not there. So can we start building new initiatives already with the long vision built in to our work rather than this short-sighted? That would be really helpful. So let me finish this call for help from you with also a wish that we could try to humanize health, working for the right to be and the right to become and the right to belong. So I look forward to hear your ideas and to bring me to a higher level on how we can embrace everyone to the work in the work that we're doing. Thank you.
Christine, thank you very much indeed. Okay, let's move to our final presenter then, and hopefully we'll have time for all of you to join us in a plenary discussion, the 5 presenters and ourselves. But first of all, it gives me great pleasure to introduce Professor John Drewery, who's Professor of Social Psychology at Sussex University, and who's written extensively on the topic that he's going to present to us now. Thanks, John.
Thanks very much. I'll just do this. Okay, everyone can see my slides? Okay, yep. Yeah, as David says, I'm a social psychologist. I research collective behaviour and in particular, how people behave in emergencies and disasters. And I want to talk to you about how people have been behaving, how, you know, the action people have taken in the pandemic. And in the early days of the pandemic, remember back to a year ago, there were 2 images that the media presented to us of public behaviour, one of which was of so-called panic buying. They said that the public were selfish, that in an emergency, these kinds of selfish, irrational behaviours might predominate. But the other image got slightly less publicity. The other image was of mutual aid groups. And in fact, thousands of these sprang up during lockdown in the UK and many other countries around the world. Thousands of them, many people involved for the first time in their lives in supporting their communities, as well as people who had previously acted as volunteers, people who previously had been activists. And they were necessary, these mutual aid groups, because if you think of the needs of public response in the pandemic, of course, we all need to keep distance. We all need to wash our hands, to wear masks and all these things. But there's something more, something proactive is also needed from the public, from the community in the pandemic. And that is to actively support people who need to self-isolate. So people staying at home because they were infected or because they were in contact with somebody who was infected, they needed their shopping done. This is basic stuff. They needed their shopping done. They needed their dogs walking. They needed their prescriptions collected. They needed their post. They needed emotional support. The government wasn't doing this. This, as in many emergencies, was a service provided almost spontaneously by the public. And in fact, having looked at many disasters and looked at the history of research in disasters, what you find is that this response is common, that people, including the people most affected by a disaster or an emergency, very frequently organise themselves and are the ones providing help. I read one study which claimed that most of the lives saved in emergencies are by other members of the public rather than by the professionals. And I don't know if that's true, but it does illustrate something which is recognised in concepts like community resilience, that you need the public not to respond in a kind of passive way, but to be proactive in events. So this has been well documented. And if you're interested, I mean, I've got a picture here on my slide of a really wonderful book by Rebecca Solnit. Now, she is a journalist, and this book is a kind of history of different kinds of different emergencies over the past 100 years, going back to the San Francisco earthquake more than 100 years ago, up to 9/11, up to Hurricane Katrina, and shows you some absolutely stunning examples of community responses in emergencies, and then sort of new worlds that were created in the months after catastrophe. Now, two types of explanation have been provided for why people tend to give so much support in emergencies. And the first is the social capital explanation, which, if you've got a social science background, you might recognize it means that people already have connections. So in your community, you've got bonds of trust, you've got good relationships in your community, and you draw upon those in the disaster to form these groups and to support each other. The other explanation is what could be called emergent groups. So that's groups that haven't got connections before, that arise within the event to provide this support, which is the complete opposite of the dominant explanation of panic, public panic, that we lose our social bonds, we become individualized and selfish and so on. And my interest, the reason I've bolded emergent groups, is that's my particular interest. When I first started looking at this, I looked at the London bombings of 2005, where there were 4 terrorist attacks in London. And why this idea arose in that context was because the people affected, who came together, who supported each other, who behaved heroically in many cases, tying tourniquets, all sorts of things, they were strangers to each other. They were commuters on their way to work, most of them, so they didn't have connections, but they became a group. It became a psychological group through sharing a social identity. And that is a key concept that we found very useful in understanding this kind of phenomenon, that we see ourselves as a group, that, who I am is a function of my group membership, and that determines my values and my interests and my actions. Now, looking at what we know about the mutual aid groups that have arisen in the pandemic, I've got a rather long quote there. I apologise for all the text, but it illustrates that what we know is that the groups that have spontaneously arisen in the pandemic are a mixture of pre-existing connections and new relationships. So, of course, they're based on neighbourhoods and your connections with people. You already have connections, but people also want to reconstrue that neighbourhood. They want to reclaim that neighbourhood. And sometimes it goes beyond public health to something else, to the future, beyond the pandemic, how they relate to their local community. They want to keep these things going. Now, the other thing we know about these so-called disaster communities, these groups that arise in the disaster and that provide this social support that people need, is that they tend to decline over time. There's some fantastic work by a psychologist in America, Chris Kaniasti, that shows this across a range of disasters. I've got pictures on the slide there of floods, because some of our recent work has been on communities arising in floods. And why that matters is because 6 months down from the flooding event which ruined your home, that amazing group that arose at the time of impact, that gave you that emotional support, that helped you bail out your house, that group has tended to dissipate and fall away just at the time when you need it, when you're trying to rebuild your home. And it declines for a variety of reasons. People run out of energy, they run out of resources, they get disempowered, the state steps in, all sorts of things. And we've seen this pattern in the activity, at least, of the mutual aid groups. This visualization is of the Facebook activity of 110 mutual aid groups from March to October. And it tended to spike up again when the second wave, the second lockdown took place in the UK. But it shows you, these groups are still alive, in fact, but they do have they had fewer requests, but they also had fewer people involved, because after the furlough scheme, which was the scheme in the UK to pay people not to work but to stay at home, but keep their jobs, after that finished, then people were less available as volunteers. And it's really crucial because we really need this right now. We've got an incredibly high infection rate. Many people need to stay at home and not getting sufficient support at the moment from the government. So I just want to finish by just telling you what we're doing at the moment in this program of work, which is to understand how these groups can sustain themselves over time, given that they're important, given that we need them, given that they do tend to decline. We've interviewed organisers of mutual aid groups, and we've asked them what has worked, what has enabled you to keep your groups going, to keep people involved, to keep people motivated, and so on. And on the slide there, you can see a variety of factors that, and Maria, who's pictured, is the main postdoc on this work, a variety of factors that people have said have helped. One is group care, that there's emotional support which is visible within the group. So people, if they get stressed, there's something to help them. Horizontal organisation means that people are able to participate, and it's not a very top-down structure that they have input into what happens. Regular communication, so we can't have face-to-face meetings, we can't have in-person meetings, but if people talk a lot about what's happening, that helps keep people in the group. And support from others outside the group. Local authorities can support through facilities and through information. Other groups can give support. And then some of them said, well, it's almost a full-time job being an organiser, and they should actually be paid, and that would help sustain the group. And there's a quote there about skills and the different roles that people have within groups. Because one final thing I want to mention that came out of these groups is that people didn't only input into the groups in terms of their motivations and their identities and so on. There was also output in terms of people sometimes getting empowered, sometimes getting politicized, sometimes getting a greater sense of community identity from being a part of these groups. And we've documented some of that on our website, and our website can be seen. This is what our website looks like, and the URL for our website is at the top of my slide there if you want to go and visit it, and I'll put it in the chat shortly.
John, thank you very much indeed. That's a fantastic finish to a tour of the territory of what's going on in the community. Lars, if you'd like to join me, we would have loved to have spent time talking to our presenters, but art is long, life is short. But Lars, should we not now maybe just try and sum up? We've only got 2 or 3 minutes really to see what we feel are the key things that have come out of this.
Sure. I think a common thread throughout our presentations have been the true resources within communities, within people, and also the challenges of dehumanization in many ways, both by actions, by language, or otherwise. Often, in this case, there's also a tying of knots that's interesting. I would love, for instance, to ask Cormac about now you have the sort of the outsourcing of agency by people. In this case, with John's presentation, also perhaps it is not just an act by the individual. Sometimes it's actually also it seems that there's some almost harmful organizations out there. Cormac, if you will, I hope you are still with us.
I'm still with you, yes, indeed. I suppose framing it in positive terms, and very much have enjoyed John's sharing there. I think what we need to recognize is there's 2 ways an organization can come alongside a community or individuals. One is they can work to transform or redefine that person out of community life and into an institutional way of being. So a program or whatever, they become defined by their relationship to the program or the intervention. The other is that they can come alongside the person and precipitate as much as possible that person to be interdependent in natural communities, and then supplement that with professional intervention as appropriate. And in a sense, what we're trying to figure out here is how we can imagine organizations as being not outsiders or insiders, but alongsiders. The difficulty is a lot of organizations, especially the bigger ones, work in such a provider rather than a prescriptor way. They're providing the solution. And in a sense, they need people's needs in the same way that the steel industry needs iron ore. So this is why we start with a needs analysis. Now, the only thing that really needs analysis is needs analysis. That's what John was saying. When we actually start recognizing you can't know what a person needs until you first know what the community has, and then you supplement that. That's what we mean by being a civil servant, a public servant. Now, the difficulty is that when we invert that, we end up with a technocracy, not a democracy. We end up with the assumption that the professional knows best rather than the citizen is at the center with the professional backing them up. And yes, that can cause disablement, and it often does.
Well, Mike, I think that's a way that we have to now wind this up, but it's a perfect thought to finish our session, which is of the citizen as center. And our task really is to help bring citizens together to make the future, as well as with help from above. So I'm very grateful. I'd like to hand over back to Jim and Sabine. So thanks to all of our presenters.
Add perhaps, David, but we will be available here on this same channel next Thursday to talk about.
Certainly will.
Of course. Sabine and Jim, thank you very much for having us today.
I just want to express that thank you also to our speakers and to David and Lars for incentivizing these health sessions. It truly is a topic that is so imperative and relevant, and I think it's the continuation of these seminars where we're going to look at health from different perspectives is needed. And there's so many questions that also arose in the chat function, so hopefully the speakers or maybe Lars and David can address those questions outside of the conference. But I also want to seize a moment to hand over to Jim, who I also know will have some concluding remarks. So thank you, everyone, and remember, stay safe and healthy.
Thank you, Sabine, and thank you, Lars and David and Cormac, Jim, and others. It was a splendid session and much needed on Humanity Rising to go deeply into these matters pertaining to public health. I love the image of the fact that we are now in a forest, not of trees, but of institutions, and that actually constitutes a major part of our predicament. If our institutions were embedded in a larger forest of trees, actual trees, the pandemic probably would not have taken place, at least not nearly at the magnitude that we're now experiencing. So I'm very grateful to all of you and look forward to the session next week. We're going to be doing this once a week, everyone, for the next 5 weeks, because we believe that the public health dimension of the pandemic is something that all of us need to understand far more deeply. Tomorrow, we are going to be saluting Stan Groff. You may remember last month, we began our celebration of his 90th birthday year, one of the giants of our time, a man who's been at the forefront as a successor to Freud and Jung and reshaping psychology and the whole notion of the transpersonal, all came from this extraordinary mind. Born in Czechoslovakia, immigrated to the United States, now living in Germany with his wife, Brigitte, and he'll be joining us tomorrow with Rupert Sheldrake and Will Keepan. Rupert, I'm sure most of you know, he's one of the most well-known biologists of our time that came up with some radically innovative theories around morphogenic fields, the whole notion that biology has memory. This year, 2021, is the 40th anniversary of his book, A New Science of Life, that shook the foundations of the scientific world. And we'll also be joined by Will Keepan, another extraordinary mind and activist who was profoundly influenced by Stan Grof, as was Rupert. So that's going to be tomorrow on Humanity Rising. Same time, same station, 5 p.m. Central European Time here on Zoom. So thank you, everyone. This has been a splendid session, and we welcome everyone to the after session chat. You'll have seen the links to the chat periodically in the chat box. So we look forward to seeing you there. See you tomorrow. Thanks so much.